Millions of people here in the United States are about to be impacted of some changes that the Trump administration is planning for Medicare and Medicaid. As of right now, the DOGE department, this is the Department of Government Efficiency run by Elon Musk, they are looking into and have been asked to look into Medicare and Medicaid from President Donald Trump. But what's to come of this? Well, that's what we're going to discuss in today's video, because as of right now, we're hearing of some potential boost for millions of Americans, but also some cuts. What we are about to see moving forward. And I want to be very clear, there's already been a pause on federal funding that has been issued by President Trump. It was something that many people were expecting, but the ramifications of this could be huge. I want to explain why in just a moment, but all I ask is one thing. Takes 2 seconds. Go ahead, hit that like button if you enjoy these daily updates. And now let's begin. So if you are currently collecting and you are benefiting off of Medicare or Medicaid, you need to watch this video, because this is going to impact every single person that is currently collecting this benefit. Here's what you need to know, okay? This is the big one. Right now, there's more than 66 million people that are collecting Medicare, okay, that get Medicare every single month. There's over 70 million people that are on Medicaid. This is for lower income people. Here's the problem. The Trump administration has now asked Elon Musk and the Department of Government Efficiency to look into these two programs, because these two programs are where we are seeing the most fraud. What does this mean? Well, are people taking more than they should? Not necessarily. Are people not paying for Medicare, like Medicare Part B? Did more people get free Medicare Part A, right? These are all questions the Trump administration is having. But here's the reason why they're concerned. It's because of many cities. Washington, D.C. was one of them, or whatever you call it. California, that was one state that was getting people to come to California, and we would give you health insurance. It would be funded by taxpayers, not federal funded, but by the state. That was how California got around it. Well, look at this. It says more states extend health coverage to immigrants, even as issue inflames the GOP. This was a article that was, I'll show you this. This was from December 29th, 2023, okay? That people were going to California to get health insurance. Guess what happened in 2024? The number exploded. It exploded. So now, what the Trump administration is saying is, we are going to go after all those people that illegally got benefits. And what are they doing now? Well, here's what the state of California is going through. Look at this. It says the DOJ memo on sanctuary jurisdiction directives cuts funding for state and local jurisdictions and NGOs. So, it says on February 5th, 2025, the Attorney General at the Department of Justice issued a memo directing the department to stop federal grants administered by the DOL from being accessed to sanctuary jurisdictions that do not comply with federal immigration laws. So essentially, they were blocked. Many cities, counties, states blocked because they were technically a sanctuary city, a sanctuary county, or a sanctuary state. I want to read this though. It says a growing number of states are opening taxpayer-funded health insurance programs to immigrants, including those living in the U.S. without authorization. It goes on to say 11 states and Washington, D.C. together provide full health insurance coverage to more than 1 million low-income immigrants, regardless of their legal status. Now, why is this potentially going to create a boost to Medicare and Medicaid? Why is this going to impact millions of people? It's simple. This change, now that the Trump administration and Elon Musk knows what they're looking for, it's going to make it very easy for them to find it. So according to reports, what we are about to see is we could potentially see 1 million plus people be de-enrolled. Okay, they would not get Medicare, even if they're paying for it. They would not qualify for Medicaid. Okay, they wouldn't get any part of this. Now, this is creating an issue. I want to explain where this issue is coming from and why hospitals and clinics were pushing the Biden administration to allow illegal immigrants, people here without legal status, the ability to get health insurance. Okay, look at this. It says there are more than 10 million people living in the U.S. without authorization, according to estimates. It says the pandemic highlighted the importance of insurance coverage to control the spread of infectious diseases, and some states are focusing on people without legal status to further drive down the country's record low uninsured rate. It says states have also expanded coverage in response to pleas from hospitals, lawmakers say, to reduce the financial burden of treating uninsured patients. Yeah, that's one of the issues. Hospitals were pleading with lawmakers. Then it goes on to say, an estimated half of the people living in the U.S. without authorization are uninsured. So that's more than 5 times the uninsured rate for U.S. citizens. Immigrants lacking authorization are ineligible for federal health programs, but states can use their own money to provide coverage through Medicaid, the state federal insurance program for low-income people. California was the first one that started doing this, and mainly they started doing it with children back in 2016. Now, here's the hard part. We are about to see millions of people, okay, over 1 million people nationwide, will be removed from Medicare and Medicaid. Hospitals will struggle. But here's the benefit to people that are currently paying for Medicare Part B. It's currently $185 a month. Based off what experts are saying is that if we remove, hundreds of thousands of people or 1 million plus people from the program, okay, that are likely, again, here's the hard part. These are likely people, especially for Medicaid, never paid into the system, never paid any money, but they are contributing to the loss of the funds, okay, because they are using it. According to reports, they are saying that this could benefit millions of U.S. citizens, legal immigrants. This could benefit them because instead of $185 a month, the prices actually could come down. If we see less people using the programs, the money's still sitting there, we may not need to continue to increase the costs. So this is actually going to reduce your monthly expense. Now, I don't know how much, but that's what they're saying. As far as Medicaid's concerned, we've been talking about this for some time. Social Security has an insolvency date. So does Medicaid. Okay? These are 2 programs that have to be fixed. We have to have some type of reform here. But it's something that is so slow, and many experts believe that no administration is going to touch either one of these programs because of the concern that what if they make a change and it's wrong and it actually increases the insolvency date, or the program just kind of falls apart altogether. That would be devastating to that party, and then the American people would likely have a tough time voting for that party ever again, according to experts. Now, I want to give you one last thing. We are going to see changes to Medicare and Medicaid. We're going to see changes to the health care programs here in the United States. That's inevitable. But as far as what these changes look like, how soon the changes go into effect, we just don't know. All we know right now is President Trump has ordered Elon Musk and the Department of Government Efficiency to look into every single program to find waste and to find fraud. That's exactly what he's doing. So, as we get more information as to where he is finding waste and fraud and who potentially will be impacted, I will bring you all the latest news and updates as soon as we get it. So again, thank you guys for watching. Consider subscribing, and I'll see you guys on the next one.